Hi, I'm Steve Rowe, CEO at Oaknoll. I'm recording this video the afternoon of Thursday, April 11th. It will be uploaded and available to you on Friday, April 12th. I'll start with a very quick COVID update. We had one person who was COVID positive earlier this week. They would have come out of quarantine as of yesterday, I believe. So at this moment, we are not aware of any residents or any staff members who are COVID positive. So that's good news. I'm going to provide a couple of updates on different things. And the first, I want to talk about the progress at 1201 West Benton, the house that we own across the street, and the plans for that to hopefully become additional licensed nursing spaces. Yesterday afternoon, we interviewed two potential general contractors. Hodge Construction was one of the possible general contractors. They built the Oaknoll East campus for us and did a really good job with that. They were great to work with and have been responsive to issues that have come up over the last couple of years since the building's been open. The other firm that we interviewed was DCI. They have a local Iowa City office now, which has been open for about 4 years. The company originally started in Des Moines, and they've been in business for about 13 years now and have done over $1 billion worth of construction projects in their 13-year history. We felt really comfortable that either of the two general contractor candidates could do the job that we've got, but ultimately we decided to go with DCI for this project. And so we talked with them earlier this morning to let them know that they were the selection, and we just want to keep this progress moving forward on that as quickly as we can so that we can hopefully start construction probably mid to late summer on that project, and just be able to work through the winter on it. So that's an update on the general contractor selection. We also, as we've talked about in the past few videos, have the certificate of need process going to officially add licensed nursing spaces. All the submissions have happened now, and we actually do have a firm date for when we are going to meet with the council that considers requests, and that is on May 16th. So about a month from now, we should hopefully know that we have been approved for additional licensed nursing spaces. Again, if we don't get that approval, we're still moving forward with a project, and we might need to call it memory care assisted living or something different than nursing spaces, but we clearly have the healthcare needs that we need more spaces that we can care for people in. So one way or another, something is going to happen across the street, and we're just kind of marching down the path of trying to make that happen as quickly as possible. That is driven by, we are a larger community. We've added several, probably 75 additional independent living households between Oaknoll East and the One University Place units that we've purchased since 2018. We knew all along that at some point we would need additional health center spaces. What we didn't anticipate is that there would be a moratorium on adding licensed nursing spaces just at the time that we were asking for them. But we're working through that process, and it's like hopefully that will happen. Well, as of today, we are full in the health center. So I know that's a bit concerning to many of you. It is something that has happened in the past. So as you know, I am very close to my 25-year anniversary. That will happen next week. And there have been a few times during that 25-year history where our health center has been full. There is a process that we can go through with the state to request a 1 over waiver, and that allows us to serve one more person than we're licensed for. So in this case, we're licensed for 58 spaces. If all 58 are occupied and we have person number 59, we can get that waiver. We currently don't have 59 beds, so we need bed number 59, and then to figure out, okay, who can we double up for a short period of time to serve that next person. In the meantime, there are some people who just need additional support and service like right now. And so we're trying to be very creative in how we do that. We are actually serving one person currently in one of our guest rooms who just needs some additional support, and it will be fine. It won't be a long-term situation, but if a bed opened up in the health center with somebody going home or somebody passing away, we would move that person from the guest room into the health center. But in a pinch, this is the best we can do, and we're going to make it work. So just know that there are always contingency plans for how we're going to do this. It might involve providing additional home care services in people's apartments. That wouldn't be the ideal situation, but it will get us through until a space opens up. In that situation, if we are full and if we're providing home care services to somebody in independent living because we're full, we will do that at no cost to the resident. So that's an important thing to be aware of as well. We've got lots of ways that we can serve people, including the home care program, and we will do whatever we need to figure out in this particular unique situation what's going to serve that resident the best that we can, and how are we going to make it through. Ideally, we would always have space available in the health center. It's been very, very infrequently that we've ever come across this, but we're here right now, and it's like we just need to make the best of it and provide service to people who need it. So just know that Kim Bergen-Jackson, our administrator and director of health services operations, Sarah Ruhlman, our director of nursing, Sheila McBride, our care plan coordinator, the apartment nurses, Stacy Edwards, Scott Wittenkeller, and our social workers. All of us are involved in trying to figure out, okay, what do we do now based on our current situation, and how are we going to provide that care? So it's something that we think about almost 24 hours a day. Fortunately, it hasn't happened that frequently that we are absolutely at capacity, but we're there today and we're figuring it out. So just, I hope that gives you some comfort and some assurance that it's like no matter what happens, we will find a way to provide the services that you need. I mentioned earlier, it's like next Friday is my 25-year anniversary. I'm starting to get congratulations on that already. Thank you to those of you who won't be able to be there and have given me a card or a note of thanks. It's very much appreciated. I love what we do. I hope to be here for at least a few more years, and we will celebrate the 25-year anniversary next Friday, April 19th. Hope you're all doing well. We'll talk with you again in a couple of weeks. Take care.